ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello, my name is Nicholas and I'm your host for today's episode of ECDC On Air, which is the podcast for the European Centre for Disease Prevention and Control. In this episode, I'm talking to Piotr Kramarz, who is ECDC's Deputy Chief Scientist. He has recently returned from a 2-week field mission to Poland, where he's been part of a group led by DG ECHO, which is the European Commission's Directorate for Civil Protection and Humanitarian Aid. The main purpose of this mission in Poland is to provide support to Poland in receiving refugees. You will hear more about Piotr's experiences there, what the situation is for Ukrainian refugees that have fled to Poland, and what ECDC is doing to assist EU member states that are receiving Ukrainian refugees. Hello and welcome, Piotr. Welcome to ECDC On Air.
Hello.
Nice to have you here. You're just back from a 2-week field mission to Poland. Can you start by telling us a little bit about the overall purpose of this DG ECHO mission that you were part of and what it does?
Indeed, I and my colleague Julian Botte from ECDC, we were part of the Union Civil Protection team set up by DG ECHO. And the purpose of the team was, the main purpose was the coordination of the flow of donated goods to Ukraine and partially also to Poland. So the team established very effectively, in collaboration with the Polish Agency for Strategic Reserves, a route of transportation of goods, donated goods to Ukraine. And the tasks of the team also included medical evacuation. And we were assisting the team from the public health point of view. And this included assistance with the medical evacuations and interactions with the Polish authorities, with the National Public Health Institute, with the Ministry of Health, and some other activities.
So you mentioned there that you and your colleague there assisted in the public health side of things. Can you tell us a little bit more what that involved?
That involved working with especially the National Public Health Institute, who is our competent body for ECDC, and assisting them with the thinking about how to enhance the surveillance system for communicable diseases and thinking about how to increase the vaccination acceptance among the displaced persons and some other issues. Poland has a very efficient system of public health surveillance, but if you think about it, receiving in a very short term more than 2 million people always needs some thinking about how to adjust the system, and we provided the link between ECDC and the National Institute to offer any assistance that would be needed.
So can you tell us a little bit more? What did it look like on the ground, these volunteer organizations and refugees that are there? Maybe a little bit more about what you actually saw.
Yes, it was a very good experience seeing the amount of help that is offered and assistance by the society, by individuals, by various organizations. We visited a lot of places where we could see and firsthand and talk to people. We saw train stations converted literally into big reception points with a lot of volunteers getting trained and then helping, taking shifts, assisting people, starting from giving them information to those who come to the train station about what to do next, and helping them get a free ticket to travel further. We had a chance to participate in some coordination meetings between different services who are assisting the refugees, including the volunteer organizations, but also the local authorities, the army, the police, the railway system. And it was really a very good experience to see the goodwill and the collaboration and in solving problems that of course appear on a daily basis. We've also seen a lot of points when you travel through Poland You see points and the resting places around the freeways where people can stop, because a lot of people actually flee from Ukraine in individual cars, and they can stop at such a point and get free food, toys for children, free starter pack for a mobile phone, and more. And these points are usually managed by volunteers and private companies offering things for free to those people. We have seen also the great service that the fire brigades are providing, both in terms of the medical care, first aid, and also transportation and logistics. And a lot of companies, we saw that they changed their logos into the colors of the Ukrainian flag. In general, a lot of flags and encouraging messages all over Warsaw and other cities and towns. So it was quite an experience, really.
I can understand for sure. And the people that are coming, I understand it's almost exclusively just women and children and the elderly, right? Because men, they cannot leave the country at the moment.
Yes, indeed. What we've seen, these are mostly women and children, sometimes older people and disabled people, which of course directs a lot of the kind of care, because a lot of it is targeting children. And what we've seen is that children, at least in this initial phase, they have a choice. They can join a Polish school where there are some programs to integrate them, to teach them enough language to start participating in the activities. But they can also, they are usually provided with some possibility to link to Ukrainian platforms to continue education in Ukrainian. Ukraine has some educational platforms where you can do classes online. I think that was developed during the COVID time and it's still active. And there is such a possibility for children to do that, either when they are with some families or we've seen it in some centers where they stay for longer period of time. There are computer rooms from which you can do that.
So during those 2 weeks that you were there, you must have gained quite a good understanding then of the specific vulnerabilities and the health needs of these people that are fleeing Ukraine. Can you tell us a bit more about that?
Yes, as part of our visit, we basically mapped the route, typical route of refugees escaping the war in Ukraine, from the border between Poland and Ukraine to a large city like Warsaw. And that gave us an idea of the vulnerabilities of these people and what kind of assistance they need. And basically, the vulnerabilities come from the fact that they are exposed to very difficult conditions during the escape from the war in Ukraine, which takes a lot of time and under conditions of hardship. And then when they arrive in Poland, they usually, most of them are placed within the communities, either with Ukrainian families who have lived in Poland or with Polish families. However, some of them, if they don't know what to do, they are placed for a short period of time in some reception centers, and there is also some possibility of spread of infections like respiratory infections or diarrheal infections. There are some infections that may spread faster in crowded environments, which people encounter when they escape from the war, and also in some reception centers. So one has to pay attention to this. But the needs of these people are far beyond communicable diseases, and a lot of them are about chronic disease treatment that they may have hypertension or diabetes, or they may be on treatment for epilepsy and they don't have medications with them. So part of the supply of medical care to them was to provide for the continuity of treatments. And this applies also to some communicable diseases like HIV and tuberculosis. They would flee without taking medications for these diseases. So one of the first steps in providing the care of these people is to make sure that there is a continuity of treatment. And the big area is psychosocial support. They are exposed to a lot of stress, and psychosocial support is very important.
And the conditions that these refugees live under, do they generally stay in reception centers, or are there other forms of accommodation that are more common?
Most of them, at least up to now, would end up being with families, so they integrate into the communities. Before the war, there are some estimates that around between 1 million to 2 million Ukrainians lived and worked in Poland, and many of them accepted refugees in their homes. But equally, a lot of Polish families did the same. However, if people who are coming to Poland they don't know where to go, they would spend some time in some centers, but these are usually days from what we've seen in the centers that we visited. And then when they recover from these difficult conditions of escaping, and get some basic needs covered, including medical needs, they usually make up their mind and they decide whether they want to stay with some families, or they want to settle in Poland, or they want to go sometimes abroad where they may have families. Quite some of them plan to return to Ukraine if the situation improves. So the situation is very dynamic, but we haven't seen typical large reception centers where refugees would stay for a long period of time. That doesn't happen. There are attempts to integrate them in the communities.
And you said you participated in some medical evacuations. Can you tell us more about that?
So far, there haven't been many such evacuations, and we had some experience with them. But what happens is that people who, including children, who cannot be provided adequate treatment in Ukraine, they are transferred to Poland and then retreated and stabilized in Polish hospitals. And then there are countries in other European member states which are willing to accept these patients in their hospitals to free up space for potentially for other patients from Ukraine. And the system works quite smoothly, and we had a chance to see it and participate in some arrangements in some cases of such medical evacuation.
So access to healthcare and access to drugs, generally, it's not really a problem for refugees coming from Ukraine.
At the moment, as most of these people are placed in the communities, they should be integrated into the community healthcare through the general practitioners. There are a lot of efforts now to equip the general practitioners, the frontline workers in general, with the knowledge of what to do if they would be providing care to displaced persons from Ukraine. ECDC published this week a guide to individual health assessment targeted at frontline healthcare workers. And there are some other materials, including some materials in Ukrainian, available in Poland to assist with this. This healthcare is provided at different stages, starting with the point of entry into the country. We observed in Przemyśl, which is a town almost on the border with Ukraine, how such a medical point works, and they provided a very efficient medical care to people entering Poland. And in general, we've seen the organization of such inflow of people, courtesy of an invitation by the president of Przemyśl, Mr. Bakun, who has shown us the whole system, how it works. And then there are medical centers or medical points in these larger centers where refugees may congregate for some time, and they get more care there because there is a bit more time. But the eventual way to provide healthcare is through the general practitioners, well, once people had a chance to settle in the communities. And I think that's the most efficient and the best way, because this should allow for providing a comprehensive care covering all the areas needed, and especially providing continuity of care for chronic conditions.
How important would you say it is to screen and vaccinate refugees upon arrival?
As I said, the ECDC published just now a guide to individual health assessments that should allow the frontline workers to get some orientation to what to pay attention to in terms of screening for some conditions. And this goes beyond communicable diseases, of course. In terms of vaccination coverage for some diseases is not very high in Ukraine, but equally it's suboptimal in many of the receiving countries. So when one talks about offering vaccination, I think one should target the whole community, and this is a good opportunity to remind the populations in the receiving countries of the value of vaccination and the need to get vaccinated.
And an influx of refugees like we're seeing now, could that potentially have any sort of implication for the spread of infectious diseases in Europe?
What happens is that these people themselves, they are vulnerable to some health problems because of the conditions during escaping from Ukraine, and possibly come from the fact that they congregate in some areas during the inflow. And that's where there should be the focus of attention and care for them, because they are vulnerable. In terms of surveillance of communicable diseases in Poland, there is an efficient system of such surveillance maintained by the sanitary inspectorate, and we observed how it works. For example, we visited the neighboring voivodeship in Poland with the capital in Rzeszów, and there the sanitary inspector, Dr. Adam Sidor, showed us how the system works, and the system covers people who are entering the country. And we know from, for example, from talking to the director of the National Public Health Institute, Dr. Grzegorz Juszczyk, that there haven't been large outbreaks of dangerous communicable diseases so far. What was observed were some clusters of diarrheal diseases. So no, I won't say they are in any way like a threat to the local population. On the opposite, they are vulnerable to some conditions.
What would you say are the main priorities for the receiving countries to do in terms of disease prevention and control? Can you perhaps summarize what we see as the main recommendations?
I think vaccination is one of these areas, and one has to think about vaccination for priority diseases. We have published the operational considerations on this early on during this crisis, and we mentioned there diseases like measles or polio as a priority. Another issue is providing the continuity of care of some chronic conditions like tuberculosis and HIV infection. But ultimately, I think the provision of long-term care is very important, and this goes beyond the communicable diseases. The provision of psychological care is very important. People who are fleeing, they also have disabilities, and this has to be taken care of. At the moment, there is a lot of activity in the population, a lot of mobilization. We have seen a lot of volunteers helping, and not just individuals, but also organizations, both public and also private, doing it for free, pro bono. But over time, there is a need to really provide for the long-term provision of care to these people. And I think it's very good that they are placed in the communities where they can be taken care of by the healthcare system. It may be that the receiving countries will need support, and we know that they already expressed some needs to receive support in the form of vaccine doses or some medications. And here the collaboration within the European Union, for example, for the mechanisms of DG ECHO, are very helpful, and we've seen how smoothly they work.
And how does ECDC intend to continue its support now for the EU countries receiving refugees from Ukraine? Obviously, it's hard to predict when this war is going to end, how long it's going to last. But I understand now we also have other colleagues from ECDC who have replaced you down there. And do we intend to continue with these missions and being on the ground like we have been?
Yes, we are in constant contact with the receiving countries. There are regular meetings with them, virtual meetings, where we at ECDC try to learn more about what the needs are. We've published a number of documents already, and we heard during our mission that they have found to be very useful. And also being there in the field helps a lot, especially in this early phase of this emergency. And our colleagues are there to continue what we started, and then we will see how the situation develops. And As you said, the situation is very dynamic, and we are trying to react to what is happening, to produce the materials and give assistance that is needed, and also to think about the future, to be also more proactive. We started thinking about some scenarios for the future, how the situation may develop and what kind of assistance may be needed longer term.
Okay, thank you. That's all the questions I have. And thanks, Piotr, for coming here today and sharing your experiences.
Thank you very much.
For more information about ECDC and its work, please visit us on the web at ecdc.europa.eu or follow us on social media.